Hi everyone, welcome to my lesson on hepatitis. There are a lot of ways to get or develop hepatitis, and in this video I'm going to talk about those different ways. We'll also cover chronic complications, nursing considerations, and hear a story about a patient with hepatitis and go through the nursing process with that patient. The liver is a very complex organ that performs over 400 different functions. It produces bile, which is necessary to break down fats in the intestine. It clears bilirubin, a byproduct of red blood cells from the body, and clears out poisonous substances. I like to think of the liver as a filter because blood from the stomach and intestines goes to the liver, where the blood, nutrients, and drugs are processed, broken down, or metabolized for the rest of our body to use, or to leave the body through the intestine or kidneys. When the liver is attacked, whether by a virus or too much alcohol, it triggers the inflammatory process in the liver, and that is hepatitis. Long story short, the white blood cells come in and the liver gets swollen, filled with all of that extra fluid that can't get anywhere, increasing pressure, decreasing blood and lymph flow in the liver. There's necrosis, there's scarring. And with all of this going on, the liver obviously can't perform its 400 functions properly. This magnified area is what I imagine hepatitis looks like on a cellular level. The hepatocytes, or liver cells, are inflamed and compressing the vasculature so that blood can't flow. The bile duct is backed up, and we can see some necrotic areas and inflammatory cells at work. Viruses are the main cause of hepatitis, but I'm going to start with the less common causes. Alcoholic hepatitis happens after really heavy drinking for many years. It causes chronic inflammation, and obviously the treatment there is to stop drinking alcohol. Drug-induced hepatitis is exactly as it sounds. Some people develop hepatitis from specific drugs, and they just need to stop taking the drug. There are autoimmune conditions where the body is attacking its own liver, and there's non-alcoholic fatty liver disease, which affects people with obesity and diabetes. The cure is focused on treating the obesity and diabetes. Now, viral hepatitis, there's actually 5 different viruses, A through E. In this video, I'm covering the most common, A through C. Hepatitis A is transmitted through the fecal-oral route, so hand washing is very important here. Food and water can be contaminated. HAV has a very quick onset. People get these flu-like symptoms and it passes without them even knowing they had hepatitis A. Hepatitis B virus can be spread through unprotected sexual intercourse with infected partners, sharing needles, accidental needle sticks in the hospital, and if you have really close contact to someone with open cuts and sores. People who are immunosuppressed either by drugs, cancer, or HIV are more likely to develop hepatitis B. Unlike HAV, it has a long incubation period and therefore very slow onset of symptoms. And those symptoms are the same, flu-like symptoms, or people don't even realize they're sick. Most people recover from it, have the virus cleared from the body, and develop immunity. But a small percentage of people don't develop immunity to HBV and actually become carriers of hepatitis, and these carriers can still infect other people. Hepatitis C transmission is similar to hepatitis B, but it's more commonly spread by IV drug needle sharing. Most people don't know they have hepatitis C. It can take months to years after initial exposure to have it diagnosed, and it's usually when they're being tested for something else or having a routine physical. Most people do not clear the virus and develop chronic infection. Hepatitis C is the leading cause for liver transplant in the U.S. Now, our patient, Hepa Stalt, came to the doctor's office and near the triage nurse. She's 24 years old and she came in because a week ago she had these flu-like symptoms with some fevers that she took Tylenol for. But this morning, her boyfriend, who she lives with, noticed that her eyes were yellow, so she came into the office. She denies smoking and drugs, she drinks socially, and she lives with her boyfriend and 2 roommates. No significant medical or surgical history, she doesn't take any medications. She did just return from a bachelorette party 4 weeks ago. She recalls eating some fish, rice, and salad from a street vendor on the way to the beach. Now let's figure out what's wrong. The yellow eyes and that she went out of the country are our biggest clues. So this is what you typically see and do for a patient with the hepatitis virus. Hepa endorses pain in the right upper quadrant when you palpate where her liver is. She has jaundice. Jaundice is when the eyes and the skin turn a yellow-orange color because the liver is unable to clear bilirubin. And you'll know it when you see it. Just imagine a yellow highlighter. That excess bilirubin is also going to cause the urine to be dark, almost brown. Patients might report light or clay-colored stool. Remember that bile is produced by the liver and sent to the intestine to break down fats, but it is also what makes stools a brown color. So patients with hepatitis might report light-colored stool or clay-colored stool because the inflammation is blocking the hepatic and bile ducts. This is another thing you'll know when you see it. I've seen stool the color of gray sidewalk cement. You want to assess the transmission risk. Does she work in food production? How many people does she live with? Are her friends from the party showing these symptoms too? To diagnose hepatitis, you check for elevated liver enzymes, AST and ALT. And for specific virus, you check for the presence of antibodies. HEPA is positive for the hepatitis A antibody. For hepatitis B, patients would be positive for the antibody and the hepatitis B surface antigen. As long as this is present in the blood, the patient is infectious. If it is present for more than 6 months, the patient is a carrier or has chronic hepatitis. But know that the surface antigen is also present in people who have received the hepatitis B vaccine or have immunity. It'll just be at lower levels. And for hepatitis C, there's a screening test, ELISA, enzyme-linked immunosorbent assay that checks for the hep C antibody. You will also see elevated bilirubin levels in the blood and urine. Now, depending on how sick they are, most patients aren't hospitalized, and they can usually go home. Our plan is to rest the liver, prevent complications, and educate the patient to avoid spreading the virus. Sometimes elderly patients are hospitalized for dehydration. So we rest the liver by avoiding alcohol and medications metabolized by the liver. We'll tell HEPA to take ibuprofen for her fevers instead of Tylenol, which is hard on the liver. We'll also recommend eating a high-carb, high-calorie diet and small frequent meals until her appetite comes back. Transmission prevention education includes frequent hand washing, especially before eating and after going to the bathroom, avoiding sexual intercourse until the antibody testing results are negative. Her boyfriend and roommates can take prophylactic drugs that provide immunity to the virus, and we might have to call her bachelorette party friends to see if they are symptomatic and educate them on ways to prevent spread of disease. We are going to follow up with HEPA weekly until her liver enzymes return to normal. She has no more abdominal pain, the jaundice is gone, and she has more energy and an improved appetite. Here are some examples of medications used for the hepatitis virus. There are immunization drugs. There are only vaccines for hepatitis A and B, and a combination one that gives you active immunity against both. You can see that these need to be given more than once. Post-exposure prophylactic drugs are going to give you passive immunity to hepatitis A and B, like we recommended for HEPA's boyfriend and roommates, but they only work within a specific time period. Hepatitis A prophylaxis must be given within 2 weeks and hepatitis B within 24 hours of exposure, followed by the hepatitis B vaccines. Interferons are antiviral, immunosuppressive, and anti-neoplastic drugs given sub-Q for patients who have not developed cirrhosis yet. Patients will have flu-like symptoms in the beginning that get better over time. PEG interferon is an example of a long-acting interferon. These have a lot more adverse effects like mental status changes. Women have to use birth control with these drugs and notify the doctor immediately if they become pregnant because it is teratogenic. Antiretroviral drugs inhibit DNA synthesis of the virus. These were developed to treat HIV, but they are approved for the hepatitis B virus. It's in pill form and must not be stopped abruptly. There is a risk for lactic acidosis, so we need to always check ABGs for metabolic acidosis. You can also get muscle weakness or myopathy from these drugs. Interferon alpha is an antiretroviral drugs for patients who have chronic hepatitis B and C. Unfortunately, they don't always work, especially for people who have a very high viral load and who already have a lot of scarring on the liver. Here are some complications of hepatitis. We talked about developing chronic hepatitis if you have more than 6 months of inflammation, usually due to hepatitis B or C, with constant hepatitis, the scarring, necrosis, destruction of the hepatocytes, your liver starts to evolve into this hard nodular tissue that severely blocks blood and lymph flow. And that is called cirrhosis, and this is a chronic condition that requires liver transplant. It causes a lot of different complications throughout the body, including anemia, pancreatitis, and encephalitis. It is also a risk factor for liver cancer. I want to finish with some precautions that you need to take as a future or current healthcare worker to avoid getting the virus from a patient or to avoid spreading the virus from patient to patient. Standard precautions are necessary when working with a patient with hepatitis, with hand washing being the most important thing. A lot of hospitals now use needleless systems that involve hard plastic tips for drawing up IV medications and twist-on ports on IVs and tubing to avoid needle sticks. It's definitely required that you are vaccinated for the hepatitis B virus, and you need to be aware of post-exposure prophylaxis so that you can educate your patients and family members. We also need to report these cases to the health department, especially if the patient works in food handling or with children. This could prevent a local epidemic. And that's all I have on nursing care for the patient with hepatitis. Please check out my other videos, comment, and subscribe.